Welcome to Health Break by UPMC Health Plan, your quick guide to health, wellness, and how to make the most of your health insurance plan. I'm your host, Dr. Camille Clark-Smith. I help to oversee the quality of the plans and programs we offer at UPMC Health Plan.
And I'm your co-host, Angelo Bartik. I'm a health coach who works with our members on making healthy lifestyle habits and setting goals. This is your Health Break. Hey everyone, it's Angelo Bartik. Today we have with us Dr. Johanna Vidal-Phelan. We're discussing behavioral and mental health in kids and teens and the ways caregivers can offer support. Dr. Vidal-Phelan, thank you so much for spending some time with us today.
Thank you so much for having me.
When we talk about kids and teens, why is behavioral health important?
Just like in adults, the behavioral health needs of children and teens are important, as they can also experience behavioral health conditions. According to the Center of Disease Control and Prevention, nearly 1 in 5 children have a mental, emotional, or behavioral health condition, such as anxiety or depression, attention deficit hyperactivity disorder like ADHD, or autism spectrum disorder. Parents and caregivers need to know that when a behavioral health diagnosis is identified in a child or a teenager, the sooner they are treated, the better the outcome. And remember, unlike an adult who can identify their own issues and get the necessary care, a child or teenager depends on a parent or caregiver to get help with their behavioral health needs. I would like to point out that children and teenagers may show different signs and symptoms when they're stressed, anxious, or depressed based on their age or maturity. For example, a preschool child between the ages of 3 to 5 years of age may present with signs like changing appetite, fear of being alone, new nightmares, bedwetting, or increased tantrums, whining, or clinging behaviors. A school-age child between the ages of 6 to 12 may seem withdrawn from peers or experience sleep or appetite disturbances, complain of random physical symptoms like a belly pain or headaches, or may seem to have lost interest in things or activities they tend to enjoy in the past. Teenagers, that's between the ages of 13 to 18 years, may also present with changes in appetite or sleep routine, agitation or decreased energy, isolation from family and friends, or a new physical symptom.
So now that we know the signs, many people are thinking, how can we help?
Well, as parents, caregivers, and grandparents, we need to help. First, we can help by being patient and reassuring, and by engaging intentionally with our children and teenagers. As a pediatrician, I need to emphasize how important sleep is for children and teenagers. Good quality sleep is an important component of your child's well-being. I always encourage my patients to avoid excessive media use, especially prior to bedtime. Teenagers who are using their cell phones or playing video games until late at night don't have good quality or sufficient sleep. The cycle of going to bed late and then waking up early to school catches up with them and can impact their behavioral health. In addition, exercise and eating a healthy, well-balanced diet are important components to support your child's well-being. Having meals together as a family helps you connect with one another after a long day at school or work. As parents and caregivers, family meals can help you interact with your child and teenager and pick up any changes in behavior that could be of concern. When a child or a teenager is worried, anxious, or sad, encourage them to reach out to you or another family member and or their school counselor. As a parent or caregiver, you know your child and teenager best. And if you have questions or concerns, please reach out to your pediatrician or family doctor to discuss them and evaluate together next steps.
What are some tools and resources that UPMC Health Plan has to offer members?
Angela, I'm so glad to share with you some of the UPMC Health Plan resources available to help you and your family stay healthy. UPMC Health Plan has health coaches that are incredible, supporting families because they not only discuss exercise and nutrition, but they also care and provide holistic support that can meet spiritual, emotional, and physical needs of your child and family. We also have a pediatric care management team, a dedicated team of social workers, pediatric nurses, and support staff that engages with our pediatric members, their parents, and caregivers. Achieving physical and behavioral health well-being is a journey, and UPMC Health Plan is proud to partner with you to support your family's goals and well-being.
Thank you so much, Dr. Vidal-Phelan, for taking a health break with us, sharing your expertise and perspective, and discussing behavioral and mental health in kids and teens and the ways parents and caregivers can offer support.
Thank you so much for having me.
Get connected with these tools and resources to support the kids and teens in your life. Find show notes and more information at upmchealthplan.com/podcast. Join us as we continue exploring health, wellness, and how to make the most of your health insurance plan in the next episode of Health Break. This podcast is for informational and educational purposes. It is not medical care or advice. Individuals in need of medical care should consult their personal care provider. Views and opinions expressed by the host and guest are solely their own and do not necessarily reflect those of UPMC Health Plan and its employees.